Welcome back to the Neuro Collective podcast. It's morning for us, but you might be listening to this at a different time of your day. But if you were with us last week, we were talking about the vestibular system. And this episode for this week is really talking about the connection or the hidden connection between the vestibular system and dysautonomia. Dysautonomia. If you are dealing with this or know someone that is, you'll know what this is. If you are not, please stay tuned because this is a very important topic today, whether or not you have this diagnosis, okay? And it's an explanation of why you may feel dizzy, anxious, and exhausted. So we want to break it down. So let's talk about a couple of things. Let me ask you a couple questions, all right? What if your dizziness, racing heart, brain fog, and anxiety were not separate problems at all? I know you know the answer to this, Doc. What if the real issue is a communication breakdown between your balance system and your autonomic nervous system? And then what we want you to know is that today we're going to discuss why so many people with POTS, P-O-T-S, which we'll explain in a minute, long COVID, concussion, as well as chronic dizziness are actually dealing with vestibular autonomic problem. So we want to break this down with you this way, because oftentimes people think they're separate problems, right? And what we want to show you today is that it's quite possible that there's a connection, a hidden connection. So we want to start with the big idea first. If you didn't listen to our episode last week, let's reiterate. What is the vestibular system, Doc? Give us a little bit of a simplistic understanding of the vestibular system, please.
Okay, well, your vestibular system is inside your inner ear. If I was to go all the way in, it would be really basically right underneath my eye, but all the way back in here. Mm-hmm. It's very small. It has 3 canals on each side, and it has a little flap-looking structure. Mm-hmm. And those structures of the vestibular system on each side peripherally will send information to your brainstem about every time you move your head, where you are in space, where your body is. So spatial orientation, maintain upright stability. So they send signals through the spinal cord down to stabilize your body so you're not falling over. And they also send connections up into the eyes so that if you move your head, you don't get dizzy. So the vestibular system is for sending information about movement and position of the head and body into your brain, and they affect many different things. Now it runs the information over the same nerve supply, if you will, right next to it, of your hearing. So many times hearing and vestibular issues can be related in terms of problem. Right? And the other thing that I would say is that, so that's one statement about the vestibular system. So as we age, all of our systems get weaker. Okay, that's a general statement. Our eyes get weaker, our sensory, right? Our eyes, our body gets weaker. Maybe our hearing gets a little bit weaker. Also, our vestibular system gets weaker. So this can contribute to a lot of different dysfunction or problems that we might experience.
Right. So that's very good. So thank you for that anatomy understanding. And we also know that it's I was doing my research and creating notes for our topic today, that it's a master regulator, right, of sorts. Would it be true to say that it helps to, or could help to regulate things like blood pressure and heart rate?
Well, yes, that's the next step, right? Okay. So we're looking at the front of a brain, basically, like if it was my brain, right? So your ears would be out here on each side. This would be the front of your brain. But down in here, this is the brainstem, right? So this is the brainstem. So each vestibular system is going to send nerve projections into the brainstem. Now, what else is going on in this brainstem? Well, we can also call the brainstem area the hub of the autonomic system.
Yeah.
Autonomic. You can also think of, for easy remembrance, the autonomic system as kind of an automatic system of sorts.
Yes.
So it does a lot of automated things that you don't have to think about consciously. Like what, Dr. Bagnell? Like regulate heart rate and blood pressure. So it's controlling some of those signals right directly down into the heart. So it's neurocardiogenic connections, right? So why is that? How is that connected to your vestibular system? Well, if I was laying down right now, my vestibular system would be giving my brain the information, you're laying down. I don't have to have a lot of tone in my muscles to hold me upright.
Right.
And I don't have to fire too much into that cardiac system to make it work really hard because I'm laying down.
Right.
But as soon as I stand up, the vestibular system is the first thing that's active as you're moving, right? So I'm going from laying down to getting up. The vestibular system says, you're moving, you're changing position. And so it's immediately sending signals down, and it should raise the heart rate a little bit, a few beats, and then the blood pressure comes up, and then it stabilizes again, kind of like a seesaw.
Yes.
When it's dysfunctional and someone changes positions, either seated to standing or laying down to sitting to standing, what happens is the brain and the autonomic system and the vestibular system and their connections are going to have a problem with regulating that. So you may get a really fast, high heart rate raise, and the blood pressure may not come up quickly. And then you have this problem where a person feels like, I feel terrible. And there's many different things they might feel. The sense of blacking out is usually one of the most common. The heart is racing, so we have tachycardia. Sweatiness, we feel a little anxious with that because then the body will feel that it's under, the brain will also experience a threat. So the heart rate goes up fast and it's dysregulated, then a person can feel a sense of anxiety or threat, right? So the brain is wired this way. It's hardwired your vestibular system into your brain stem, your autonomic center. And so any dysfunction there, whether it's a weakened brain stem because you're older, or you've had an injury like concussion, or as you mentioned, you've had long COVID or some type of neuroinflammatory, which has hit your brainstem hard and weakened it. So this vestibular signals coming in may not be processed timely in a very short fashion so that you can regulate these things very quickly. So I like to say, based on a friend of ours up in Michigan, Dr. Kaiser, and we talk about this often, that we could really summarize a lot of the autonomic function as moving blood flow around the body as needed. So if I'm running, I need blood flow in my legs and my lungs. If I'm doing something with my arms, I need blood flow to my arms. If I'm doing something cognitively, I need to get blood flow to my head.
True.
So if I can't regulate that really well because of the brainstem, the autonomic center, then we have a problem.
Yeah.
And what we have found out, and what you're getting into even more and more, is that the vestibular system can be a window in to strengthening and improving and helping people who have some type of dysautonomia.
So let's talk about that, because I was going to ask you about the vestibular autonomic connection, which you just beautifully described for us, which is good. But for those that are listening or watching today, and maybe dysautonomia is new to you, or maybe you heard the term, but you're not really familiar with it because it's not something that perhaps is a concern to you personally, but you also may be listening and this is you, right? But give us an explanation of dysautonomia, like a simple, what's happening in the autonomic system, and what is a person feeling? What could they be feeling as a result?
So we'll go back to this area just as a model, the brain stem, right? From the side, the brain would look like. And now all of this is inside the skull. The spine would start about here, the first vertebrae. So this is inside your head. And so this stalk, this brain stem here, is controlling things like swallowing. So you may have difficulty. Well, I'll mention that in a minute. It's controlling things like swallowing. It's controlling, as we mentioned, heart rate, and affects blood pressure down lower. It also is involved with eye movements, pupillary responses to light. So as you go through this, phonation would be another one. Let me think what else. Sensation on your face would be another one. Control of your tongue, sticking your tongue out and not having it deviate and being able to control your tongue and swallowing. So there's many functions here. And secondarily, this is where much of our neurotransmitters are produced. Dopamine, serotonin, acetylcholine, which affect things like mood and movement and being able to sleep and feeling good about life and satisfied, and memory and sharpness, right? So you're producing a lot of your neurochemistry here. It's controlling a lot of these automatic functions, like I mentioned. So when something goes wrong here, because we've had an injury, or there's a problem with the post-infection, or someone's aging and it's getting weaker. We could have problems with moving my eyes. I can have like, wow, I try to read and it's really a problem. I can't do that, right?
Yeah.
Especially if you had like a concussion or something like this. Or you could be very light sensitive because your pupil reactions are different.
Right.
So now you're light sensitive. And there's actually an area up here that affects sound sensitivity. So noise and light can be too much. It can affect mood very much. As I mentioned, the neurochemistry. So I can feel very low in my motivation. I can feel very depressed. I can feel anxious, like you talked about in the very beginning of this the podcast as one of the symptoms. So we get down lower. Problems with swallowing. Maybe I'm choking a little bit on my saliva, which I never did before, or I have a stronger gag reflex. Problems with food. We see this a lot in older people, not so much in younger ones, but in the older population who are dealing with a dysautonomia. So what is dysautonomia? D-Y-S, difficulty with, right? So dysfunction. Right?
Yeah.
Yeah, same thing. So there's a problem with the autonomic system, dysautonomia. It's a condition that encompasses a constellation of many different symptoms, possibly. Everything that this autonomic system connects to. And we can say that the autonomic system connects to all of your visceral organs. Another one I'm thinking of now is people say, oh, my eyes are so dry, or I don't produce enough saliva. That's very commonly autonomic. I have a lot of bloating in my gut. Of course, we have to rule out what they're eating and food sensitivities and allergies and food combining. And we know that GI problems, whether it's they're constipated, or they're having diarrhea, or they're bloated, or anytime they eat, they eat and they feel like, oh, my heart starts to accelerate. I don't feel well. That could be related to dysautonomia. So you can have dysautonomia for a variety of reasons, the autonomic system dysfunctioning, and it can cause you to have different types of symptoms, and you may pursue that with that type of professional. What do I mean? You might end up at the GI doctor because you're bloated a lot or constipated.
Right.
They may never consider, is this really the bigger picture of dysautonomia, or is it just I need some kind of, as we pharmaceutical for my or more fiber for my constipation.
Right.
Someone else may end up at the EENT saying, I have fullness in my ear, my eyes are very dry, my mouth is dry all the time. And they may not think, is there a bigger picture here of dysautonomia? Or in fact, as we talked about initially, the heart rate and the blood pressure.
Right.
And so this is where it's important to step back as a physician, clinician, like we do, consider the big picture, get a very good history, and find out, is this part of the whole? And through the actual testing, we can find out if dysautonomia is actually the cause of many of their different symptoms. And then how do we go about getting into that system, maybe through the vestibular apparatus and into the brainstem, to rehabilitate it and get them stronger? And that's really the difference with functional neurology and some of the other things that might be out there.
Yeah, I love that. As I'm listening to you, I always have to go back to, the importance of having a systems-based approach to healthcare versus a symptoms-based approach. And I was having a lovely conversation with the mother of a new client of ours yesterday. And we were talking about this, right? Her daughter's been through a long journey with her health. And we're pretty clear that she's dealing with some level of dysautonomia based on the initial conversation and then assessment yesterday. But to your point, they've been to all the different specialists, in the clinical settings, as you described, to deal with all those things. And of course that makes sense, right? Because, we don't want to remain with our symptoms, right? Who wants we want to be relieved of our symptoms, and symptom relief is not the enemy here. Symptom relief is, we get that. But typically what happens is we stop at symptom relief, and then we might be on this hamster wheel of symptom relief over and over and over and over again, because we haven't addressed the system that's creating the symptoms. Oh, I said that without being a tongue twister, right? But it's a lot to consider. But when you're talking about is looking at the systems behind it, and the brainstem, very notable. The vestibular system, very notable. And we haven't even talked about the vagus nerve, but all of these things are part and parcel of what could be happening for a person. So the most important thing to take away from the understanding of dysautonomia, I think, from what you're saying, is that we got to look deeper, right? We got to look at these other things. And, I was reading an article, and I knew this from before, but I was reading an article, doing a little research earlier today, and it was about the brain gut axis. And I was reminded that in fetal development, the brain and the gut are developed from the same tissue, the same fetal tissue. So we think they're disconnected. We don't think that, but the world is just, and science is just starting to have the conversation with people about brain gut axis, right? It's everywhere now. But if we think about it, the gut is and the brain are made from the same fetal tissue. So of course there's a lot of similarities. And when you feel nervous, I mean, this is just like what everyone understands. When you feel nervous and you feel butterflies in your stomach, why do you feel butterflies in your stomach when you feel nervous, right? Or people will say commonly, I had a gut feeling about that, about something that they know, but they had a gut feeling about that, right? So these are things that we could all say we've had shared experiences, perhaps, but maybe not put two and two together. So that's just one way of looking at just the marvel what it is to understand this human body and the brain. And really, we're beginning to scratch the surface on all of this. But the information that we currently have and continues to advance is so powerful and so powerful for people to bring hope back to them, because there's not a lot. And we've worked with a lot of people with dysautonomia. And not that everything that we've done has been the 100% answer, right? Because there's lifestyle interventions a person has to do. There's additional things that have to happen. But we know that if you don't address the system, then you're going to be on this hamster wheel of chasing the symptoms. And it'll be just one day I feel good, one day I don't feel good, right? That's just a really, really difficult way to live one's life, because it's difficult to plan one's future when your present feels very uncertain.
That's very good. I mean, you covered a number of things there that are very helpful for people to consider in this. I want to read to you two statements that I have written down earlier, and that dysautonomia can amplify vestibular symptoms. So what does that look like? If someone has a little bit of dizziness or a little bit of feeling of vertigo or movement, like back and forth, if you have dysautonomia, you can amplify that and make it feel worse. Now, the converse, vestibular dysfunction can intensify autonomic symptoms. So you might say, well, I don't have dizziness or vertigo, but man, oh man, my symptoms, as you said, they're terrible some days, other days they're manageable.
Yeah.
Your vestibular system could be intensifying that because it's not working in an integrated way.
Right.
What do I mean by that? Because I feel like this podcast is a little bit more complex for people.
Yeah.
So I want to help them understand how things have to integrate.
Sure.
Have you ever watched something? We've had this experience, so it's rhetorical for you. When we're trying to get the synchronization of the podcast before we start, and we hear an echo, and it's like, wait, or it's delayed. I move my mouth, and then you hear the sound. There's a lack of integration, and it's confusing.
Yes.
This is what happens between this system and the brainstem system. The integration is off in movement and in different things. When that integration of your sensory systems is not like this, perfectly matching, it's more like this, skewed, as an example, right? Perfectly matched, hand on hand, skewed, then the brain has problems. It has problems with different things like movement, like control of moving blood flow around, problems with thinking, right? So the integration of systems has to be very tight. So when I snap my finger, you hear it right when you see it. Not that I do this and then you hear it later. That's not integrating. And that's what happens with many of our systems, why we have symptomology, especially when it comes to dysautonomia, a lack of integration that's tight the way it should be.
Yeah, very good. Yeah, that's really important. And that lack of integration, we talk a lot in an upcoming course that we are delivering virtually about signal restoration. right? Because
Yes.
we need to restore those signals for that connection and for that sense that you just showed with your hands, not to be an overlap, but to be a match, right?
Yes. To be a match.
So let's step into anxiety and dysautonomia, because we know that they can travel together, right? As it said. And I want to read something because I feel, and you can expand on this, but I feel like it's important connection to draw, because a lot of people who deal with anxiety, let's just use anxiety and not even talk about depression, who deal with anxiety don't necessarily believe or have been told or understand that they have dysautonomia of some sort, right? Or a
True.
brainstem issue or a vestibular imbalance, because no one's looking at those things, right? You have anxiety. If you're on the holistic side, you meditate, you breath work, right? You try to have a stress less life as much as possible. If you're not into that, you go for the pharmaceuticals to help to just, down regulate your nervous system so that you can function, right? But here's what we want to say is that, and I wrote a couple things down earlier. So we know that the brain interprets physiological instability as danger.
That's true.
That's what you said earlier, right? It's when the brain creates a threat response to this physiological change. And then
When you're unstable, let's slow that down for a
when you're
minute.
unstable.
So if you push me and we're standing just outside and you just push me or bump me by accident and I feel unstable, it's a threat and I try to catch myself, right?
Yeah.
It may be only momentary, but if you push me really hard, the threat in response to my body is larger. Oh my goodness, right? And so my body's sorry, I'm making big eyes here. So yes, so now if I just have it internally, every step I feel like unstable, then my brain is consistently dealing with a heightened threat response in the amygdala, in the limbic center, and this creates more instability in the brain and the vestibular system.
Yeah. Well, the brain's in higher vigilance, right?
Right.
These systems in higher vigilance. And so the result then, and I'm not saying it always is true, but the result then can feel like a person's feeling panic, right? Or anxiety.
Right.
Hypervigilance, right? Fear of movement. We know a few people who they just didn't want to move too much, right? Because they had intolerance to movement because of this instability. And also something that doesn't get talked about a lot, which is you hear it a lot in psychology, which is this experience of derealization.
Yeah. Derealization.
Could it be, and of course, there's no cookie cutter answer, but could it be that anyone who's experiencing any one of those things could have an imbalance in these other systems that are co-creating this experience that they have?
Absolutely. I would say absolutely. In my professional opinion, when you have vestibular integration issues, even in the absence of dizziness, it could contribute to depersonalization, derealization, perceptions.
Experience, right.
Experience, yes, absolutely. Because you have these sensory systems that are not synchronized. The signals are not patterned together. And so you get a separate kind of feeling in your body. The most obvious example of that, which we can just kind of transfer a little bit into that, the DPDR, is when someone has vertigo. I feel like they're holding on for dear life. They feel like the room is spinning, but the room is not spinning. So their brain is saying that the room is spinning because of some kind of input that's gone awry. And so the perception is the room is spinning or I'm spinning. The reality is nothing's spinning.
Right.
Map that onto the other thing. I feel disconnected from reality. Right, but you're not. But your brain is telling you that. And it could be, this is what we're saying, people, it could be related to vestibular integration issues in your autonomic system. And until that is looked at and considered, it's still a question mark. And we don't like question marks when we can answer them.
Yeah, I love that. We don't like question marks when we can answer them. I like that. So let's draw some additional connections, right, to conditions where we commonly see vestibular dysfunction overlaps, right? So obviously POTS, which stands for, I might say this wrong, but postural orthostatic tachycardia syndrome. Yep, I got it.
Right.
All right, so things
change positions, and then your heart races, and it's going up like 30 beats. Like laying down.
It's really significant. Yeah. Because your heart
you
should
feel
race,
terrible.
not race. Your heart rate should raise when you stand up, but not 30
Couple of
beats.
beats.
Yeah.
Couple of beats.
Long COVID, which of course we've seen that in clinic. Concussion, vestibular migraines, PPD, which is
PPPD, correct.
persistent postural perceptual dizziness. I had to write that down because it's like, wow, it's a lot of P's. Then, of course, you said earlier, chronic vertigo, functional neurological disorders, and then, of course, chronic anxiety, which we've just talked about. And, the reason why we're mentioning this is because if you're listening to this and you yourself or know someone that is suffering chronically, not acutely, but even acutely, but chronically with any of the things that we've just listed just now, there's a high probability that the vestibular system and the autonomic system are involved. And what we just want to know is we just want to tell you that, there's a potential significant answer to that is, quite life-changing for people, especially after they've gone through a lot of providers, well-meaning people, men and women, trying to serve them and trying to help them heal, right? But if you can't see something, you can't do anything about it, right? If you're not looking at, the right, map, let's say we want to travel to Oklahoma, but our map is taking us to Ohio. Okay. Oklahoma and Ohio, well, it kind of sounds the same, but totally different places. So we need a map that takes us to the correct place to travel to the correct place.
Right. Yeah, I like that. I like that analogy. We want to have the correct map to travel to the right place to see if that's an area that needs some attention, especially when it comes to the brain. I have this note here. Visual motion, right? You see things moving on the highway or in the supermarket, or there's people, busy environments, visual motion, and rapid head movements can trigger autonomic symptoms, and when the vestibular processing is inefficient. So someone has a bit of an asymmetry in their vestibular function. You might not even know it because you're not dizzy. So why would you think that?
Yeah.
And so we can test that because that asymmetry is inefficient, and you can compensate for quite a while, but maybe not if you get sick, maybe not if you hit your head, maybe not as you get older. And so as you can't compensate, now you might start having autonomic dysregulation, especially with rapid head movements, busy environments, or visual motion. And those are the ways we want to re-synchronize the brain by using strategies through neuroscience, what we would talk about as functional neurology, to reintegrate the systems so that the busy environments aren't a problem. There's no more autonomic dysregulation coming from that, and the visual motion doesn't affect someone. Yeah. So this is really at the bedrock, and the foundation is finding the right map, or we'll say testing in different ways to understand how we can apply therapies, rather than what is typically out there is drink salt water. We saw this yesterday. Wear compression socks. Okay. Number 2, take a beta blocker. Number 3, and then maybe even, which we've heard in many cases, several other meds or something for depression or anxiety. So we have a different view. We have a different map. We have a different car to take us to more of a solution, we hope. And that solution could vehicle. Be resolution of the symptoms by getting into the mechanism that has gone awry. So this is important for people because when you Google, POTS or dysautonomia, it'll say often there's no cure. I reject that. Same. I say there are ways to rehabilitate the areas of the brain in many cases that need to be strengthened so the person can live a more normal, functional life. Yes.
And we see it every day in clinical practice. We see it every day. So the hope in neuroplasticity and in neuroscience and functional neurology is there, right? It is absolutely there. And we see it in the successful outcomes of our clients. And, we are so grateful that that's true, and to watch them go back into their lives and do the things that they want to do. It's just amazing. One thing that I want to draw a distinction to, people will often ask, do you treat, and then whatever it is, right? Do you treat? And what I would like to start to change the language or the understanding is that we're not treating, we're training. right? Because you can retrain the brain to have that balance again. You can retrain the vestibular system to come back to that, right? So we get it when someone asks, do you treat this? But I really would love for people to understand that it's trainable, because treatment seems like, well, I take something for it, or I might do something for it, and I always have to treat it, right? Versus I can train my brain, hopefully, and my nervous system out of it, right? Into a new, back to factory settings, maybe, maybe not. Maybe we can't go back to factory settings, but we can certainly be, refurbished, right? In a
Well, we
way
can
that
upgrade the software, maybe. Maybe we can
operate
upgrade
the,
the software,
upgrade the software.
strengthen the hardware, strengthen the
Exactly
hardware.
right. Exactly right.
Yeah.
And software
I
and
like
hard.
what you're saying. I'm sorry. I like what you're saying, because I think we do need some new language around a lot of things.
Yes.
Really, to reframe it, like we talked
Yes.
about. We on one of our podcasts about many of these disorders, ADHD, ASD, and we called them distinctions. Not that we're trying to be fancy and just
No.
create, no, because we want to look at them from a different lens, with a more positive view, because there are things that can be done to improve people's brain function. And that's exactly where we stand with dysautonomia and POTS.
Yeah, I love that. All right. There's so much more we could say on that, but we're probably going to do a third piece on this. But for right now, those of you that have stuck all the way to the end, thank you. And we want to remind you that you can heal.
We can help.
And we can help. Take care.